So you've finally gotten your ADHD diagnosis. It should be easy for you to get medicated now, right? Wrong. Some doctors won't even prescribe it. And if they do, finding the right medication and the right diagnosis can be a painstakingly difficult task. And although I can't recommend any specific medication for you or anyone, I can help bust a few myths, give you tips on how to make it easier, and explain some of the struggles you may face. Let's get started. Welcome back to Creatively Divergent. If you're new here, I'm Kristen, a fellow ADHDer and creative mindset coach. I'm here to help you create a better, more neurodivergently aligned life. And one of the ways that a lot of ADHDers do that is through medication. My personal journey with ADHD medication is a little different than most people's, but it turns out it's actually not that rare. I was prescribed an antidepressant 10 years before my ADHD diagnosis. For me, medication was a lifesaver, and that's the case for a lot of ADHDers. In fact, many studies show that children that go untreated for ADHD are more likely to grow up into adults with substance abuse problems. So you'd think that getting medicated would be a relatively easy process. Why isn't it? Well, the truth is that there are no one-size-fits-all medications for ADHD. There's just a whole lot of trial and error. Finding the exact right medication and dosage can take a lot of time and patience. The effectiveness and side effects of a medication can be different for everybody, and timing matters too. A medication that works perfectly for 3 weeks out of every month is not necessarily going to be the right dosage during your period. Medications can lose their effectiveness over time, and even the changes in your needs and demands can have an effect on how well they work. Often, it's not a problem with the medication at all. It's a problem with the setup. A lack of sleep and nutrition can negatively affect the potency of a medication, which gets tricky since sleep and diet can be challenges for ADHDers, regardless of medication. Not to mention stress, and even things as simple as how much caffeine you have can have an effect on how well a medication works. Another big problem is that medication can help you focus, but it can't determine what you're going to focus on. So you may take it so you can study, and instead you end up cleaning out your fridge. It's like getting surgery on your spine. It might fix the paralysis, but you're still going to need to learn how to walk. We have all sorts of mental muscles that we're not using when we're struggling with ADHD that we're going to need to strengthen on our own. Medication can't strengthen it for us. It's going to take our own hard work. Also, and I've actually heard this so many times, medication can give you such extreme fatigue, you assume that it's not working at all. I mean, it's a stimulant after all. But the thing is that a fully functioning brain needs rest to heal. And if you haven't been allowing your brain, or your ADHD hasn't been allowing your brain to rest, getting put on these medications is going to help your brain function properly. And a properly functioning brain needs rest. So all of a sudden, you can be exhausted and think that the medication isn't working when in reality it's working perfectly fine. You're just burnt out and you need rest. So with all these possible side effects, how are you supposed to know what's what or when you found the right medication? The trick is in the tracking. The truth is that your ADHD memory sucks, and so does your perception of reality. There's no way to keep all of this information stored and organized in your brain. So get a cute new notebook or take one from the stack of unused notebooks you already have. I know you have them. Or if you're so inclined, use a notes app. Whatever works. But start keeping track of all these little bits of information. Write down the name of the medication, the dosage, what time of day you take it at. Write down side effects. Consider things like your mood, stress, sleep patterns, and any physical changes like headaches or an increased heart rate. Also, and this is a big one, don't worry about perfectionism with this. If you forget to keep track, don't worry about it. Just write down on the days that you do remember. If you only write down once a week or once a month, that may still provide vital information that's going to help you and your doctor figure out what works for you best. And if you've already gone through this journey of medication, put your story in the comments. Sharing our experiences makes our community stronger. It helps all of us. And if this is brand new to you, you might be wondering what to do with this information once you've gathered it. And the first thing is to bring it to your doctor's appointments. At best, this process is an educated guessing game. And it's a much easier game to play when you bring receipts on how it's affecting you. And there's a very good chance that your mind is going to go completely blank the moment your doctor asks you, "How have you been?" Having a detailed notebook on everything you've been experiencing is going to help your doctor so much, and in turn, you. Secondly, look for patterns. Things like, it works great until 3 p.m. and then I crash. Or my anxiety increased when I first started the medication, but after a couple of weeks it subsided. This is going to prevent you from repeating patterns that didn't work for you. Like the first 2 medications you tried gave you heart palpitations after 30 milligrams. You may not want to go above 30 milligrams for the third medication you tried. Things like that. Remember, finding the right medication is a team effort, but you are the MVP. Trust your experiences and expect your doctor to do the same. Don't hesitate to ask for or about changes. Adjustments are to be expected, but so is understanding why your doctor is making those adjustments. And don't compare yourself to others. Your friend might be having tremendous success with a specific medication for their ADHD. It doesn't mean it's going to work the same for you. And if it doesn't mean you're doomed. Just keep trying and keep keeping track of what you're doing. And always celebrate the small wins. Finding the right medication is a slow and subtle process. You're not going to necessarily experience this drastic change that makes you know for sure that the medication is working. Although sometimes that happens. If it doesn't, don't despair. These things can take time, and a small adjustment in the dosage can make all the difference. You can also decide to skip medication altogether. ADHD meds, at best, can only help you function more neurotypically, or at least appear to be functioning more neurotypically. And at the end of the day, there's nothing wrong with being different, especially if you're willing to lean into it. And one more thing, whether you're just starting to figure out this whole ADHD thing, or you've been medicated for years and happen to be a woman in her 40s, you may have noticed that your symptoms have increased drastically. If that's the case, check out the video above on perimenopause and ADHD. It might be exactly what you've been missing. Thanks for watching. I'll see you next week. Bye.